Thank you so much, Mildred, and good morning to you and our viewers. Indeed, it is not such a good development in line with the most recent executive order by President Donald Trump on halting all further foreign aid until it is under review. Now, it has begun to bite with the United States Agency for International Development halting any further funding on new projects and it needs to be noted that the USAID has a portfolio of about 1.5 million US dollars that it has invested in different places, in different projects, particularly on the health sector. Here in Uganda, you have things like maternal health, malaria, HIV and AIDS, all these initiatives that the USAID has been supporting. Now, it puts quite a strain on not just the health sector, but the plight of medical workers in the country is definitely not going to be the same. But to truly understand the scope of the problem, we talked to the president of the Uganda Medical Association to shed light on just how big the problem is in terms of the health workers, in terms of public service delivery on the health front, but also what is the long-term impact of such a pronouncement, of such a development on our health sector. Good morning, Doctor, and thank you so much for joining us this morning. Let's just get into it. The plight of medical workers with this kind of pronouncement, we have freezing of funding on various projects. Just give us the scope of what we face today.
As we speak today, we estimate the risk to be around 2,000 health workers about to lose their jobs, and some of these ones have already been told to stop any work they have been doing and first go home and actually rest, and many more are likely to be facing the same. And the worst scenario is that during these 90 days of assessment, some of these project work or activities where US has been providing funding, they may not survive. They may say after the assessment they have done, the US is not going to continue to provide this kind of funding, meaning these people will never go back to work to receive a salary or any kind of earning. And when you look at 2,000 health workers, including doctors, nurses, lab technicians, it is a very big number of health workers. And in Uganda today, we have been facing a challenge of many juniors, more so the medical officers, about also 3,000. We have been advocating for to be deployed to Health Center 3s to start working. Now you see the number of unemployment among health workers is going to swell to about 5,000. So we think as Uganda Medical Association, number one, to help the clients or the Ugandans who are going to suffer, who have been receiving services, HIV/AIDS services like ERVs, prevention of malaria and distribution of NAIDS, family planning services, increasing maternal child health survival. The government, since we are in the budget process right now, need to adjust and change their priorities. We need more money in the health sector. In the current financial year of 2024-2025, we received a budget of 27%, but this was added together or bombarded together with education, water, sanitation, and hygiene. Those are about 5 things. And the money which was provided was about, it was actually 10.216 trillion. And this is almost the same amount of money we lose in corruption when you look at the IGG report of 2023. So it is a little money. So I think the government needs to rethink and focus more on the social services which have listed, health, education, water, and sanitation. These are very important, and they serve or affect directly the people on the ground. And we put more money in that area. I don't believe that the government of Uganda can fail to provide these services, even these ones which are being provided using the US money. We can afford to provide those services, because if they only provided 10 trillion, which we are in this running financial year, and we lose the same amount of money in corruption, meaning we can get this same amount of money from other budgets, and actually these services can continue using Ugandan money, which the people are paying in their taxes. I think the government of Uganda should honestly not find any excuse Number one, the parliament should give us a wage to operationalize the new public service structure. We deploy all medical officers and health center 3s in the country, fill up the gaps in the national referral hospitals, regional referral hospitals, so that at least we push beyond the less than 60% employment coverage we have today. Then all these services can be pulled back into the public facilities and then provide money for more resources from the same government, and the Ugandans will actually not be affected. I think it is not right for our government to rely so much on this kind of donations, because when such a things happen and then you start going into a panic, a full country, it is a bit embarrassing. So we request the government, this is a budget process, it's good this is coming now, we have time, let us adjust our budget and provide enough funding to the health sector. At least we should be able to provide 15% to health alone, not bundling it with other sectors. And all these things will be history.
Doctor, before I let you go, I just have a question when it comes to what the association is doing to support this current burden that has just come up.
At the moment, we are talking to our colleagues. Of course, we are receiving phone calls from those the colleagues who are already leaving. Someone gives a call and tells for us, they have told us to pack. We have gone home, and some of the members are not even sure if they will receive a salary in the next 90 days, because if you are not working, you can't be sure if your boss is going to pay your salary. But we have advised some of our colleagues, those ones who can afford, who have security, to come to our circle, Uganda Medical Association circle. They can borrow some money which can help them to survive for the 90 days, and then they can send back the money later. For now, that's the strategy we have. And maybe also to talk to colleagues who have private facilities where they have slots and they can employ our colleagues and use their skills to take them up as we watch the situation and look for other strategies on how we can help them. But most importantly, and now we are going to strongly go ahead, advocate with the government. These health workers should be redeployed into government facilities and services reallocated, and the government should own them.
Long-term impact on the health sector, long-term impact on the citizens of Uganda. What should they brace themselves for?
If the government does not change their priorities and provide enough funding to the health sector, we are going to have a very big problem. Maternal mortality is going to increase, neonatal mortality is going to increase, because that area has been funded a lot by the US government to ensure that the survival of mothers and children during labor is increased. So if the government does not put money there, we are going to lose more mothers and more children during labor. HIV patients, the rate of death of HIV patients has not been very high. Actually, it has been reducing, more so to those ones who are adhering to their ARVs. So if the government does not invest in that area, we are going to lose more patients of HIV, and the incidence will actually increase. Now, when you look at the area of family planning, we have been having many young children, 13 years, 14 years, and many unwanted pregnancies, and many deaths due to criminal abortions. So that area is also going to be a lot of trouble. We shall have a high fertility rate. Mothers will be producing more. We shall be losing more mothers because of abortions. So you can see it is a very big problem.
Well, thank you so much, Doctor, for shedding light on what the future looks like for the health sector, for the citizens of this country. And we can only hope that government intervenes and, escalates this, especially the budget, make sure it covers the current loopholes that this pronouncement has on the health sector. Well, that is the situations. Mildred, back to you at the Political Command Center.